Facial aging affects the entire face, but nowhere is it more noticeable than the area around the eyes. The eyes are truly the window to our soul and oftentimes affect how we are perceived on a day-to-day basis. When facial aging occurs in the area of the eyelids, people frequently tell us that we look older, and how we look can change how people perceive us. When we have excess upper and lower eyelid skin, not only do people think we look older, but they oftentimes think that we look tired and less energetic. When we have brow descent, it's not unusual for people to think that we have a concerned look on our face. And in many cases, they feel that we look angry. For these reasons, upper and lower lid blepharoplasty surgery and brow lift surgery are some of the more commonly requested facial cosmetic surgical procedures. When the aging process occurs, the area around the eyes is often the first place to demonstrate aging. This starts in our 30s when we develop excess upper and lower eyelid skin, which is often accompanied by fat accumulation. As the process continues, our brow starts to drop. And when our brow drops, people think we look concerned and on occasion, even angry. The analysis of the problem is critical. Do you need a brow lift? Do you need upper and lower blepharoplasty? Or do you need both surgical procedures? This is in many ways determined by the physical examination. And it sounds simple at first because it seems like, well, you just address the anatomic problem. But there's a significant amount of interaction between the soft tissue of the brow and the eyelid, which requires that the surgeon have significant experience in this area to make the right decisions. At Aesthetic Surgical Images, we utilize computer imaging, and we find that this is extremely helpful in making this determination. Once that determination is made, some patients may need upper and lower lid blepharoplasty, while others need a brow lift. But many patients will require both procedures. At Aesthetic Surgical Images, we feel the analysis of the problem is critical to obtaining an excellent result. Not only must a careful evaluation occur of the patient's anatomy, but a careful evaluation of the patient's aesthetic goals must occur as well. When these factors are considered, excellent aesthetic results can be obtained by applying the right technique to the correct problem. Depending on the particular patient, this may involve upper and lower lid blepharoplasty, brow lift surgery, or possibly brow lift surgery in combination with blepharoplasty surgery.